Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Racism, a Public Health Crisis, and I will be discussing how racism affects the health and well-being of a certain population at risk, which is minorities living in America. The learning objectives for the audience are that the audience will demonstrate understanding of racism as a social determinant of health. The audience will describe the health implications of racism. The audience will describe the financial implications of racism. The audience will advocate for anti-racist policies and practices. The audience will list resources to find more information. Before I begin the presentation, I have included a short pretest for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. When we discuss how racism affects health, we must have a good understanding of social determinants of health. The CDC defines social determinants of health as circumstances in which people are born into, where they work and live, and the healthcare system. The four categories are socioeconomic status, psychosocial factors, environment, and political, economic, and cultural drivers. Healthy People 2020 identifies discrimination, including racism, as a key factor affecting social determinants of health. Structural discrimination takes place in the form of racial segregation in housing, inequities in education, access to health care, and in the criminal justice system, and it influences overall health and well-being. Social determinants of health affect individual health and population health, therefore impacting our healthcare system. Not only do social determinants of health affect outcomes, they also affect health inequities. Another health aspect of racism is that the chronic stress that it causes leads to vulnerability to illness. Health implications. Racism impacts health in many ways. According to Healthy People 2020, racism has been directly linked to low birth rate, high mortality rate, hypertension, and overall poor health status. In addition, the 2015 National Healthcare Disparities Report claims that white patients receive better quality of care than 36% of Hispanic patients, 41% of Black patients, 32% of Native American patients, and 20% of Asian patients. These are just a few examples. There is volumes of research that confirm the health implications of racism. Financial implications. Racism costs society directly through the healthcare system and indirectly through loss of productivity and premature death. An estimated $230 billion was spent in 2003 to 2006 on race-related health disparities, directly affecting the healthcare system. During that same time frame, an estimated $1 trillion was spent on indirect costs associated with race-related health disparities. It is clear that the financial burden has a negative effect on our healthcare system. Policy and practice. It is important for healthcare workers to incorporate policies and practices of health equality into their professional practice throughout their entire careers. There are many ways to accomplish this. Increasing awareness and advocacy of anti-racist policy and practice is a lifelong and ongoing practice goal. Anti-racist public health curriculum in all healthcare education settings with a focus on health disparities among minorities reduces stigma around the social hierarchy and allows healthcare workers to have a strong awareness of these issues from the very beginning of their practice. Another barrier that minorities face is the lack of providers that practice in underserved communities. Programs to incentivize and increase healthcare workers and students practicing and learning in underserved communities encourages investment in these communities. Increasing communication and cultural competency skills is another way that healthcare workers can incorporate principles of health equality into their personal practice. Structurally, employers and educational institutions can add anti-racist principles to job descriptions, performance reviews, and general vocabulary. Healthcare professionals can engage with anti-racist organizations as a way to learn more on an ongoing basis. And one of the most important things that healthcare professionals can do is to advocate for health equality. Traditionally, healthcare professionals have strived to be apolitical, and in doing so, have inadvertently perpetuated discrimination in healthcare. It is now clear that healthcare professionals need to change their approach through advocating for health equality. These are all strategies to build a lifelong anti-racist practice. In conclusion, social determinants of health are circumstances that determine health outcomes, and race is a social determinant of health. Structural racism impacts the health of minorities and is a huge financial burden for our healthcare system. Structural racism needs to be addressed through anti-racist policy and practice. Education, training, and employment all offer opportunities to adopt anti-racist policies and practice. Healthcare workers are in a position to advocate for minorities from a public health perspective to improve social determinants of their health and therefore improve access to healthcare and equity. For more information, visit the Center for Disease Control and Prevention's website and Healthy People 2020.